guys, Dr. Lavan here again. So we're back onto our osteoarthritis of the knee, I think we're talking about now. So Rachel, I'll let you take it away.
Sure. So, I mean, how many osteoarthritic knees do you see coming into primary care? Lots. Osteoarthritis is a very, very common condition that unfortunately does affect people later on in life. People age 50 is around the mark we start to develop a little bit of osteoarthritis. So osteoarthritis is wear and tear of the joints and the cartilage. And if we look at the knee here, the cartilage is this pink bit here, and then we've got the bone underneath. Slowly over time, that starts to erode down, the joint can change shape a little bit, and that's what we know as osteoarthritis. You can get it in many joints, but today we'll talk about the knee. Symptoms of osteoarthritis: you might feel clicking, you'll definitely feel pain in the knee as well. You might feel kind of crunching as well, and you might not be able to move your knee and bend your knee as much as you used to be able to.
Great. And in terms of treatment for these kind of knee arthritis, I mean, we've always been told, unfortunately, because it's a wear and tear, and as we get older, we're getting arthritis typically in a lot of areas, especially our weight-bearing areas. So knees are a common area, and our lower back. Limited on what we can do, but I understand from a physiotherapy point of view, kind of certain exercises can help with that.
Yeah, so there are lots of things you can do to help your knee pain. Sometimes losing a bit of weight can help. If you think about it, if you've got more weight pushing down in your joints, that's going to be causing you more pain. So if you're able to lose a little bit of weight and you know you're overweight, that's definitely beneficial to do. Other things, gentle exercise is definitely beneficial for osteoarthritis in the knee. You want to strengthen the muscles around the knee to help support that joint a little bit more, and once the muscles around it are stronger, it should start to alleviate your pain a little bit.
Great. And of course in the surgery, I myself do what we call steroid injections into certain joints. I give it mainly to improve quality of life. There are some cases where there's some elderly ladies who sadly have not even been able to walk up their stairs, and thankfully because of these steroid injections in their 80s, 90s, it's giving them their quality. But the benefits in younger we're not so sure about, and is it really worth going down that path, or what do you think?
I think if you're a lot younger, hold off the steroids. Steroids have side effects long term, and whilst it might be a quick fix, I don't think it's beneficial long term. It's definitely maybe useful in a slightly older patient who might find it a little bit more trickier to do their exercises and actually might just benefit from a quick fix kind of thing. Right. It depends from person to person, but the younger the person, we try and avoid the steroids.
That's great advice. Thank you very much, Rachel.
So a strengthening exercise for our knee, if you've been diagnosed with osteoarthritis of the knee, is some gentle squats. Make sure you have a chair to hold on to or a firm surface before you do your squats. Danielle's going to demonstrate a squat now, so she's going to just go down and bend her knees. Good, and come back up. Keeping a nice straight back as she does, so you can go back down. Perfect, and up. Those will strengthen the big muscles at the top of our legs, and it will strengthen the muscles around our knee, which we discussed before, will help alleviate the pain. One final exercise for our knee osteoarthritis is going up onto our tiptoes. Again, find a nice solid surface you can hold on to, and again, find a nice solid surface you can go up onto your tiptoes from and hold on. So if Danielle goes up onto her tiptoes and back down. Perfect. This is strengthening the muscles at the back of the leg, which helps support the knee and again will help alleviate your pain.